Presentation. Now I request Dr. Aruna AC for the presentation.
Your topic is an analytical study on inner retinal layers thickness in the type 1 diabetes without retinopathy.
Good afternoon, one and all. I am Dr. Aruna, postgraduate from Madurai Medical College, Tamil Nadu. Here I am presenting on an analytical study on inner retinal layer thickness in type 1 diabetics without retinopathy. As we all know that diabetic retinopathy is one of the leading causes of visual impairment and preventable blindness. It is one of the microvascular complications associated with type 1 diabetes. Initially, the etiology of diabetic retinopathy is solely attributed to the microvascular changes. However, a new pathophysiological model has become accepted over the past decade, emphasizing that neurodegeneration is an important and early component of the retinopathy. Aim of my study was to analyze the differences in the retinal thickness in patients with type 1 diabetes without retinopathy and healthy subjects using spectral domain OCT. Hypothesis is there is a relative thinning in RNFL and GCC thickness in type 1 diabetic patients as compared to the normal age-matched individuals. The objective was to determine whether undetectable early morphological and neurological changes are present in patients with type 1 diabetes without retinopathy using spectral domain OCT, and to determine a correlation between glycosylated hemoglobin levels and inner retinal layer thickness in type 1 diabetes to demonstrate a relationship between the age of onset, duration of type 1 diabetes to the RNFL and GCC thickness. Duration of this study was 6 months and it was a comparative cross-sectional study. Sample size was 75 type 1 diabetic patients and 75 age-matched controls. Study population 18 to 45 years of age, attending outpatient department of ophthalmology, Government Rajaji Hospital, Madurai. Results and analysis. The table on the right shows the distribution based on the age. The mean of 29.32 in diabetic group and mean of 30.12 in non-diabetic group was noted, which was not significant, statistically is not significant. And on the left, there it is the table shows the distribution based on the gender. There was equal distribution among the diabetic and the control group, and it is also not statistically significant. This table shows the comparison of BMI in both groups. That BMI in type 1 diabetic patients was significantly lower than that of the normal population. Based on this BMI, the study group was classified into 3 groups and the mean RNFL and GCC thickness was calculated. The mean RNFL thickness showed a significant statistical correlation with the BMI with RNFL thinning noted in people with subnormal BMI, with most of the subnormal BMI belongs to the diabetic patient, and also the GCC thinning noted in people with subnormal BMI. This chart shows the comparison of HbA1c value with RNFL and GCC thickness. Based on the HbA1c value, the study group was classified into 4: normal, pre-diabetic, diabetic and uncontrolled diabetic. From this, it was shown that the diabetic and pre-diabetic groups have thinning in the RNFL and GCC. Based on this comparison between the average RNFL and GCC thickness with the duration of type 1 diabetes, the patient with more than 20 years of diabetes shows the thinning in the inner retinal layer. This table shows the comparison between average RNFL and GCC thickness in both groups. The inner retinal layer thinning was noted in diabetic population. This chart shows the comparison of average RNFL and GCC thickness in both groups. In this, the diabetic patients have thinning in both RNFL and GCC thickness. Correlation, there was a significant good correlation with the HbA1c value and the retinal layer thickness, and a very low negative correlation between diabetic duration and retinal layer thickness. Conclusion of my study was there is significant thinning noted in the peripapillary and the GCC thickness in type 1 diabetic patients without retinopathy when compared to normal population. Hence, the suggested hypothesis was proved, which further denotes that there is neurodegeneration happening prior to the microvascular changes in diabetic retinopathy. The inner retinal layer thickness was reduced in patients with poor glycemic control, and larger the duration of diabetes, more was the amount of thinning noted in the retinal layers. Thank you. Yes, sir. It was one of my limitation of the study, sir.
When you calculate the same findings are there in some other studies. They have also 50, 75 is too small
Yes,
to
sir.
calculate a sample size.
Duration of my study also very less, sir, so we took only.
This is not a prospective study, that is fine. No, but sample size looks very.
Yes, sir. It was one of my limitation of my study.
Thank you, Dr. Sam. Any other question? It's a good presentation. Thank you.